Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
I am Dr. Omar Shafi, consultant ENT head and neck surgeon, currently working at JLNM Hospital, Ranawari. Today we'll have a discussion on vertigo. The topic is understanding vertigo, why it happens, and what it means. Have you ever turned in bed, looked up suddenly, or stood up and felt like the whole room was spinning? If yes, you're not alone. That spinning feeling is often called vertigo. And for many people, it can feel confusing, frightening, and deeply unsettling. Welcome to Study Balance. This is episode 1. Today, let us understand vertigo in simple words, what it is, why it happens, and what your body may be telling you. First, one important point: vertigo is not a disease by itself, it is a symptom. In simple terms, it is a false feeling that you are or the whole world around you is moving even when you are actually still. Some people describe it as spinning. Others describe it as swaying, tilting, or feeling pulled to one side. It may also come with nausea, sweating, unsteadiness, or sudden fear because your sense of balance is no longer normal. So, how does the body normally keep up the balance? Your balance depends upon three systems working together: your inner ear that senses movement and position, your eyes that tell your brain what is happening around you, and your muscles that tell your joint and the joints that tell your brain what the body is in space, where the body is in space. Your brain blends all these signals together every second so that you can stand, walk, turn, and move safely. What the signals match, when the signals match, you feel steady. When they do not match, the brain gets confused, and that confusion can lead to vertigo. In many people, the problem starts in the inner ear. Inside the inner ear, there are tiny balance organs filled with fluid and delicate sensory cells. The semicircular canals help detect turning movements of the head. The utricle and the saccule help detect straight line movement and gravity. When this system sends a wrong message or the message does not match with your eyes and body sensing, the brain may wrongly think that a movement has happened. That false message creates the spinning feeling of vertigo. This mismatch can also lead to nausea, vomiting, unsteadiness, and or all abnormal eye movements. So if vertigo has ever made you feel frightened or helpless, please remember this. It is a real physical symptom. It is not imagined and it should not be dismissed. One of the most important causes of vertigo is BPPV, for short, benign positional vertigo. The name sounds complicated, but the idea is quite simple. Tiny crystals in the inner ear can move out of place. What happens rolling in the bed, bending down, or looking up can trigger the sudden spinning. The good news is that this type of vertigo is very common and often treatable. Other causes include vestibular neuritis. This happens when the balance nerve becomes inflamed, often due to a viral illness. The result can be sudden severe vertigo, nausea, vomiting, and trouble in walking steadily. A third important cause is Meniere's disease. In this condition, change in the fluid balance inside the inner ear can interfere with the normal hearing and balance signals. Along with vertigo, a person may also notice ringing in the ears, hearing loss, or a feeling of fullness or pressure in one of the ears. It is also important to know that not all vertigo comes from the ear. Sometimes it can be related to the brain, for example, migraine, multiple sclerosis, or other neurological causes like strokes. That is why vertigo should not be ignored if it comes with a warning sign like double vision or slurred speech or facial weakness, numbness, trouble walking, or sudden severe headache. In these situations, urgent medical attention is of utmost importance. The good news is that many causes of vertigo can be treated. Some people improve with a simple head positioning maneuver in BPPV, like Epley's. Others may need medicine, balanced exercises, or treatment of the underlying cause. So, the key message to remember is that vertigo happens when the body balance signals become mixed up and the brain senses movement that is not really there. If you or someone you know is having repeated spinning episodes, falls, hearing changes, or severe symptoms, please do not ignore them. With the right evaluation, the cause can often be understood and the treatment can help bring confidence and balance back. Thank you very much. Looking forward to further such episodes. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.